Hello, I'm Dr. Michael Fisk from White Oak Chiropractic in Vacaville, California at whiteoakchiropractic.com. I want to tell you a little bit about Advanced Biostructural Correction, or ABC. This is a really wonderful technique that I've been doing since 2005. I've done over 10,000 treatments and I find very remarkable and wonderful results with it. So I want to tell you a little bit about my history, about why I came to be looking for ABC, about how I came to find it, how ABC is different from other chiropractic techniques, what exactly it is, and how we do it. So I became a chiropractor later in life. I decided that I wanted to spend the rest of my life helping people in the very best way that I could. I was inspired to become a chiropractor because I went to a chiropractor who was doing some unusual or out-of-the-box techniques, and I saw that chiropractic was not a kind of profession where you had to do one thing, like, for example, perhaps a podiatrist, but you could do many different kinds of techniques that could help people in very many ways. And I wanted to find the very, very best ways that I could to help people. So that was my quest. When I was in chiropractic college, I was very curious and inquisitive. I investigated things a lot. In fact, I was one of those kind of semi-obnoxious people who would always sit in the front of the class and raise their hand all the time. And one of the questions that I had for my professors was, what's the best chiropractic technique? Now, many people don't know that that's even a question that you can ask, because most chiropractors practice pretty much the same way. But in fact, there are about 200 or 300 different chiropractic techniques. And so I wanted to find the very best one. But the professors were not able to answer that question. One of them said, well, we haven't done the research to find out. He said chiropractic research is only about 20 or 30 years old because we've never had the money to do major research like the pharmaceutical companies have. And he said, we don't have the data. We haven't compared one technique against another. And I was a little disappointed in that answer. I thought he must have some kind of opinion about it, but he wasn't saying. So I went to another professor who I knew had done many different techniques in his career. He'd been a chiropractor for over 30 years. And I asked him, and he said, well, they're all good. And again, I was a little disappointed in that, but I think that what he meant was that the human body is very, very complex, and there are many ways to affect it and change it. And if a technique is really not helping people, it will just die away. Well, I've always been one of these kinds of people who loves to research and investigate things. And if I want to buy a car, I'll drive 10 or 15 cars and I'll read all the car magazines and all the reviews on the internet and everything to try to figure out what's the best car. So I tried to do that with chiropractic techniques. Now, the school I was going to was in Los Angeles, and there were many chiropractic technique seminars being given in the area there. And so I took as many as my time and my budget would allow. They're much cheaper for students, so I was able to do that more easily than I could now. And I also went to lots of different doctors who were doing different techniques. And I said, can you please do your technique on me? I want to feel what it does to my body. I want to see how it works. And they were happy to do that, and they don't charge you as a student, so that was not a cost for me. So after doing all of this investigation for some time, the first conclusion I came to was, well, I guess they're all good, because they all seem to be effective in some way. It was kind of like having different kinds of tools in your toolbox. But I was very aware that all of them had limitations and restrictions. And one of the limitations that they all had in common was none of them could correct posture. Now, I was very interested in correcting posture. I didn't exactly know why, and I didn't know the importance of posture. It turns out that it's very important, and we'll talk more about that a little later. So then I came across an ad for Advanced Biostructural Correction, or ABC, in one of the chiropractic newspapers. And it showed someone standing in a slumped posture, and then after one adjustment, standing much more upright. It was quite a remarkable change with one adjustment. Quite amazing. And so I thought I really needed to investigate this. And I looked into it, and I found that the developers of ABC had discovered something about the human body, and this is going to sound kind of unbelievable, but it's true, which no one in the entire history of human health care had ever focused on or tried to change or tried to correct. And when you correct this one thing, it changes the human body to such a major and profound extent that now I say, after having done about 10,000 treatments in my clinic, that ABC is the best chiropractic technique that I know of so far. So, how does it work? Let's look into that. So, ABC is based on the idea that the human body is to a large extent self-healing or self-correcting. Obviously not completely, or we wouldn't need doctors, but for example, if you cut your hand, that will heal by itself, and if you break your arm and get it set properly, that will also heal. And in the same way, and a lot of people don't think about this, but the spine can be self-correcting or self-healing also. Now this is the back of the spine, and this is the front of the spine. There are muscles that attach to the vertebrae from the side like this, and from the other side also. So that if a bone in your back, a vertebra, gets pushed to the side like that, there are muscles over on this side that could pull it back to center and so correct it. And in the same way, if a bone gets pushed up or down, there are muscles that could pull it back to center. But now this is what Dr. Judkowitz, the developer of ABC, saw that no one else had seen before. If a vertebra gets pushed forward, which would be this way towards the front of my body, there are no muscles directly behind the spine that could possibly pull it back again. Now take a moment and feel your back. And you can feel the bones or the vertebrae in your spine directly through the skin. That means that there are no muscles back there that can possibly pull them back again. So, therefore, every time that a vertebra gets pushed forward towards the front of your body, it is going to stay there. Now, what pushes a vertebrae forward? Well, you fall off your skateboard, you fall off your bike, you fall out of the apple tree, you wrestle with your big brother, you play football or baseball or soccer or cheerleading, or you go skiing, or you have a car accident, or you drive across the country in the bad airplane seats or the bad car seat. All of these things that are either major trauma or mini trauma or even micro trauma, like sitting in a bad computer chair all day long. All of these things can push the spine forward, push vertebrae in the spine forward. Now the first time I heard that, I thought, okay, it must be that when a vertebra gets pushed forward, that this one will move forward and all the other vertebrae will stay the same. But that's not what happens, because there are ligaments that tie all of these vertebrae together very strongly to keep the spine together. And most of the time you're either standing up or sitting up so that the vertebrae are stacked on top of each other like this. So when this vertebrae gets pushed forward, the whole thing goes forward like that. And now you're bent forward and you're kind of looking at the floor, and your brain is hardwired to keep you upright so that you don't bump into things and fall down. So your brain will send out an alarm to your body, stand up, and your body tries to pull this vertebra back, but it can't do it. So what does it do to get you upright? It compensates. it pulls and turns and twists in all kinds of ways, and some of these vertebrae will go this way and some will go this way, and your hips will turn and twist, and your legs, your knees will turn and twist, and everything is turning and twisting to get you back upright again. So next time you're in a big crowd of people, look around and look at the shapes of people's bodies, and you'll see some very interesting things. First of all, you'll see that everyone, particularly as they get older, is bent forward. But it's not just older people, because a lot of the younger people are engaging in these very active sports now, like snowboarding, where they go up on the ramp and they come down and they smash themselves. I got this one young guy who comes to me who does this BMX bike flipping. He goes up this wooden ramp 30 feet in the air and comes down, and if he misses the jump, he's going to smash and his whole bike will come down on top of him. And he gets up and he feels fine and nothing's broken and there's no blood, so he thinks he's okay. But in fact, what he's done is he's smashed his whole spine down like this, and lots of vertebrae have been pushed forward. So he's walking around like this. Now, if you go to an MD and you say, boy, I really feel like I'm slouching, he'll say, well, so that's aging, meaning I don't know what to do about it. Or he may say, you know what, let's send you to the physical therapist. And the physical therapist will then try to strengthen your back muscles and stretch your front muscles. So they'll work on strengthening the lower traps and the rhomboids, for example, and stretching the pectoral muscles in the front, which may help some. But you see, the problem is what we said, that when the spine, when the vertebrae gets pushed forward, there are no muscles that can possibly pull the vertebra back again. So it's not correcting the shape of the spine to do that. The spine is still bent forward. You may get the person a little bit straighter, but the spine is still bent forward. It's similar to if your car has an accident and you smash into a tree and the whole frame is bent to the left. Now, the door doesn't close right, and the trunk doesn't close right, and the windows don't roll up and down properly, and the whole thing is squeaking and rattling. And you take it to the body shop, and he says, okay, let's put some WD-40 on the door and put some Bondo on there, and we'll make it look nice and make the door close right. And you say, well, no, I don't really think that's solving the problem. I think you need to straighten the frame. And so he says, okay, let's straighten the frame. He straightens the frame, and now the door closes, and the trunk closes, and the windows roll up and down, and it doesn't squeak and rattle anymore. So when you straighten the frame of your body, which is the spine, a lot of these problems will go away. Now, the second thing that you're going to see in a big crowd of people is all of the kinds of compensations that people have in their bodies as a result of the body turning and twisting and pulling, which is what causes the pain, and by the way, all of those distortions in the body. So all of these compensations get generated because the body is trying to keep itself upright. And let's take a look at some of those. So the second thing you'll see if you look at a crowd of people and look at the shapes of their bodies is you'll see all of the many different kinds of compensations that people's bodies have because vertebrae are pushed forward and the body can't correct that. For example, the pelvis can be tilted forward like this, which gives the person kind of a sway back and makes it look like their rear end is sticking out. Or the pelvis can be tilted back the other way, which makes it look like their back is straight and they have no rear end. Next time you walk on the beach, take a look at the footprints, and you'll see that a lot of people are walking around with their feet splayed out like this, like ducks. And I always used to wonder, why is that? Why are they doing that, and what does that feel like to them? I finally figured out the reason for this. The normal position of your feet is kind of straightforward and a little bit turned out. Now, if you push this person forward because the vertebrae are forward, after a while they can't balance anymore and they have to turn their feet back like this to keep themselves from falling on their face. But what is the cost of that? There's tremendous torsion on the hips and on the knees. And I was recently reading a study on arthritis. It said that there were 3 major causes of arthritis: heredity, trauma or injury, and the alignment of the joints. So if the normal position of the knee joint, for example, is like this, and there's tremendous torsion on the leg that makes the joint uneven, there's going to be crunching and grinding, the joint's not going to be working properly, and over time that joint will develop arthritis and possibly even need a knee replacement. So there's tremendous cost to that. Now, all of this torquing in the lower body can go up into the upper body, and you could have one shoulder higher than another. A lot of people have that. Maybe this is an exaggeration that I'm showing to illustrate this, but one shoulder higher, or you'll see a head rotation or head tilting. Even some of the newscasters on TV have this. Look carefully and you'll see it. So over time, all of these distortions build up in your body. And you go to the chiropractor and you look like this. Now here's the difference between ABC and regular chiropractic. You walk into the chiropractor like this, and again I'm exaggerating, and you say, oh, my neck is killing me and my low back is killing me and my knee, it's popping and it hurts when I go up and down stairs. And he says, okay, let's adjust your neck. Pop. Let's adjust your low back. Pop. Let's adjust your knee. Pop. How does that feel? And you say, oh, wow, yeah, that's much better. Thank you. Then you go out, and then however long it takes, 3 days, 1 week, 2 weeks, you're back again. And you say, oh, my neck is killing me again, and my low back and my knee. And he does the same thing again. You see, he doesn't have the knowledge that he can look for and find the source of this long chain of compensations that has ended up with you being distorted like this. The source being the vertebrae that have been pushed forward that the body can't correct. That's why ABC is a totally different paradigm from any other chiropractic technique or any other technique of body work. It's revolutionary. It really is, and it's an amazing thing, and it produces amazing changes to the human body. Now, what do we do when we do ABC? So, I go through and I check every single vertebra from C7 down to L5, every single one, to see if it's forward. An ABC adjustment takes about 3 times as long as a normal chiropractic adjustment, or maybe more. I use a system which I'll explain to you while I'm adjusting you for finding the vertebrae that are forward. Well, let's say I find that this vertebra is forward. The body can't pull it back because there are no muscles behind it that can pull it back. So I have to move it back. So what I do is I put my hand on the vertebra below, like this. I have you stand with your back to the wall. You cross your arms and you bend forward. Now that opens up this gap right here. Then I press on your arms like this. And because I'm blocking this vertebra, this one is going to go back. That's how we do it. Now sometimes there's a pop or a click that you'll experience. Sometimes there's not, depending on the position of the vertebra, how long it's been there, how much inflammation there is, how tight the muscles are, how much it can move at that time. But I always check it before and after to make sure that I moved it as much as it possibly can be moved. We go all the way down the spine, checking every vertebra. We also check this bone here, which is called the sacrum. Now the sacrum, you'll see, is kind of triangular in shape, and it's between these 2 hip bones, which are joined here by a semi-movable cartilage. If this triangular bone is shifted like this, it will shift the hip bones and get them out of place, causing torquing in your whole body. So we have to get this squared away, which I do, and then that will square the hip bones. I also check the leg bones, which fit right into the sockets right here, that they're seated properly in the socket. Then I go down and I check the small bones, which are called the tarsal bones, in your foot. Now those tend to fall down towards the ground like that because there are no muscles above them that can possibly pull them up and correct them. So I'm going to push those up again, which will help your foot to form a better arch and support your body better. I also correct the bone on the side of your leg, which is called the fibula. There are muscles from the pelvis that come down and attach to the fibula, so we want to get the fibula in the right place so that the muscles are not pulling on the pelvis. I'm adjusting all of the things in your body, or most of the things in your body that your body cannot correct by itself. And it's a total body adjustment. Your whole body will change from this one adjustment. And we check that. Before I adjust you the first time and afterwards, we're going to do a check of your posture, your breathing, a little of your range of motion, and a little of your movement. And we'll check those things before and after to see how much they change in one adjustment. And it's usually very noticeable. So, that's ABC. Now there's one other part of ABC that's very, very interesting and important for you to understand. Let's take a look at that. There's another part of ABC that is very interesting and powerful. A few other systems have tried to do what this part of ABC does, but none, in my opinion, have been as successful. Here's where your brain would be. Here's where your face would be. This is one of the pieces of your skull, this piece right in the back of your skull here. Down from the brain, as an extension of the brain, comes the spinal cord, which goes down in a channel inside the bone. You can see the metal piece there representing the spinal cord. This goes all the way down and out through these holes here, as an extension of the spinal cord, come the nerves, and the nerves go to all the parts of the body. Now everyone knows that the nerves are responsible for touch and feeling. What we don't think about too much is that the nerves carry the impulses from the brain to the muscles that tell the muscles to contract and relax, and that's how we move. So if I do this, the brain is sending signals through the nerves to the muscles to tell the muscles to contract and relax. As well as that, the brain also sends signals through the nerves to the organs, the heart, the lungs, the kidneys, all of those things, to tell them to work. So the nerves carry the messages that allow us to feel and touch, that allow us to move, and that allow the organs to function in our bodies. Now, the brain and the spinal cord, which goes all the way down inside the canal in here, are completely covered by a thick membrane or skin, which is called the meninges. Now you've heard of meningitis. Meningitis is an inflammation or infection of the meninges. Now ABC has nothing to do with meningitis, but I mention that just because people have heard that word. So the meninges is this thick membrane or skin that surrounds the brain and also the entire spinal cord. This whole thing is called the central nervous system. So the skin goes around the brain and the spinal cord. Now it turns out that the meninges can get stuck to the inside of the skull and also to the inside of the spinal canal. And you can see it. You can actually see pictures of it. And I'm going to show you those right now. So, this is a cross-section of the mid-back or the thoracic spine. Now the white you see here is the spinal cord. The outside edge of the white on either side would be the meninges. The black here is the space inside the spinal canal. And this is how it's supposed to look, free and open like this. Now you see down here how it's totally stuck to the side, how the meninges is completely stuck to the side?
And that's how stuck it can get. Now, do you see in here that there's extra stuff in there? It looks like extra skin or something there. That's where the meninges is starting to stick to the side. So we say the meningeal adhesions are forming there and starting to stick that to the side. Here's another mid-back or thoracic spine. Now you see here it's kind of open, and it's stuck in these different places here, and then there's lots and lots of adhesions building up on the other side there. Lots and lots of meningeal adhesions forming. This is a neck, or the cervical spine. Now you see here that this is open here, and you see how the meninges is completely stuck to the side of the spinal canal here. And over here, can you see all of the meningeal adhesions building up there? And then right through here, everything is completely stuck to the side. Here's another neck, and this one is of an older person, I would guess to be in their 80s. Look how the meninges is completely stuck all the way down on either side, completely stuck to the side of the spinal canal. Now obviously that is going to be affecting the range of motion, the neck range of motion of this person, but it does a lot more than that, and we'll talk about that.
So, you can see how the meningeal adhesions would affect range of motion, but they actually do a lot more than that, because what they're doing is they're pulling and in fact stretching all of the nerves. And when you stretch a nerve, you decrease the conductivity of the nerve, the ability of the nerve to conduct the impulses from the brain to the other parts of the body. So all the functions of the nerve that we talked about before will be affected. First of all, there's touch and feeling, so people can develop numbness and tingling. Now, numbness and tingling can come from two places, either inside the spine or outside the spine, or both. So in other words, the meningeal adhesions can be a factor in causing numbness and tingling. It could also be, though, a local problem. For example, the muscles in the arm squeezing on the nerves and causing numbness and tingling there. So sometimes you have to treat both the problem in the arm or the leg or wherever that the numbness and tingling is, and the spine itself. But releasing the meningeal adhesions in the spine will almost always have a wonderful effect on reducing the numbness and tingling. Secondly, we talked about the nerves affecting movement, or bringing the impulses from the brain to the muscles that allow us to move. Now, you've seen people with foot drop, where their foot is very heavy and it's dragging on the ground. That's an extreme example of a nerve damage affecting the ability of the muscles to move. I've sometimes experienced having a weak grip, which would be the same kind of thing. In fact, everyone experiences some of this. Most of the time you don't realize it. Even the most fit people on the planet, Olympic athletes or professional athletes like Lance Armstrong, experience this. Most of these athletes have a chiropractor that travels with them and treats them before competitions or meets. And one of the things that the chiropractor will do usually is muscle testing. So they'll test one muscle against another. For example, one shoulder muscle against the other, or the quad, the leg muscle, one against the other. And they'll almost always find weaknesses. And why is that? It's not because the athlete is training one side of their body harder than the other. It's because the nerves are not conducting properly to the muscles. So there are ways of optimizing this nerve function, and ABC is a very, very powerful way to do that. Lastly, we talked about the nerves carrying the messages to the organs to get the organs to work. And ABC is well known among ABC doctors and patients for sometimes very hard to explain improvements in problems with organs that many times the MDs could not find the answer to. The tests were negative, the diagnosis was unclear, but the problem was still there. I had several cases like this. For example, one woman came to me with progressively worse problem controlling her bladder. This was a woman in her 50s. Now that's not an unusual problem, but the danger signal, in fact it's a red flag, is that the problem was getting progressively worse and worse. Now this could be, in fact, a tumor growing in the spine, pressing on the nerves going to the bladder. So many times doctors in training are advised that if they see something like this, they need to tell the patient to go to the emergency room. Well, this woman had come to me from the emergency room. She'd already been there, she'd already been checked out. They had done all the tests that they felt were necessary, X-ray or MRI or CAT scan or whatever other tests they did, and they couldn't find anything wrong. She came to me, and with one ABC treatment, she was 60% better. With 2 ABC treatments, she was 80% better, and with 3 ABC treatments, she was 100% better. I was at that time working in a chiropractic practice that saw low-income people, and I didn't see her again. It's not that I told her not to come back, but perhaps she moved, I don't know. In any case, her problem was completely better at the time when I stopped treating her. And I've had other cases similar to that. So when we clear up these meningeal adhesions, all kinds of wonderful changes can happen in the body. Now you saw how stuck the meninges can get in the pictures. So what do we do to free them up? It's a kind of stretch. So what I do is I put your body in a position where the meninges is already stretched, and then I stretch you further to get some of those stuck places free. For example, one position is you're lying on your back on the chiropractic table, and I bring up your knees and I bring up your head. So I curl you into a ball, and you see how that would stretch your spinal cord. And then I stretch your head over to the side, which puts more tension on the whole thing and gets some of those stuck places free. Now, it feels like a strong stretch, and most people have no problem with it. A few people might have a little bit of discomfort, but for maybe 10 or 20 seconds afterwards, maybe right up in here. But I will take you into this stretch very slowly and gradually to make sure that it's comfortable for you. So, that is the whole ABC story, and you're ready to begin your amazing journey with ABC. And many times it is amazing. I have done, as I said before, about 10,000 treatments, and frequently I still am amazed. So, let's get started.